Welcome to ENT students. This presentation will be dealing about the clinical features, investigations and the management of deviated nasal septum. Coming to the clinical features, nasal obstruction. Depending on the type of septal deformity, obstruction may be unilateral or bilateral. Respiratory currents pass through upper part of nasal cavity. Therefore, high septal deviation cause nasal obstruction more than lower ones. Headache. Deviated septum, especially a spur, may press on the lateral wall of nose, giving rise to pressure headache. Sinusitis. Deviated septum may obstruct sinus ostia, resulting in poor ventilation of the sinuses. Therefore, it forms an important cause to predispose or perpetuate sinus infections. Epistaxis. Mucosa over the deviated part of septum is exposed to the drying effects of air currents, leading to formation of crust, which when removed causes bleeding. Bleeding may also occur from vessels over a septal spur. Anosmia. Failure of the inspired air to reach the olfactory region may result in total or partial loss of sense of smell. External deformity. Septal deformities may be associated with deviation of the cartilaginous or both the bony and cartilaginous dorsum of nose, deformities of the nasal septum or columella. Middle ear infection. TNS also predisposes to middle ear infection. Investigation. When examining a case of nasal obstruction, one should ascertain the site of obstruction in the nose. It could be vestibular or at the nasal valve or atic or turbinal or choanal. Cottle test. It is used in nasal obstruction due to abnormality of the nasal valve. In this test, cheek is drawn laterally while the patient breathes quietly. If the nasal airway improves on the test side, the test is positive and indicates abnormality of vestibular component of nasal valve. Management. Minor degrees of septal deviation with no symptoms are commonly seen in patients and require no treatment. It is only when deviated septum produces mechanical nasal obstruction or the symptoms given above that an operation is indicated. Submucous resection operation. It is generally done in adults under local anesthesia. It consists of elevating the mucoperichondrial and mucoperiosteal flaps on either side of the septal framework by a single incision made on one side of the septum, removing the deflected parts of the bony and cartilaginous septum and then repositioning the flaps. Septoplasty. Curvilinear incision with convexity forward at mucocutaneous junction. Elevation of flap on opposite side. Elevation of mucoperichondrial and periosteal flap on same side. Incision on the septal cartilage. Septal cartilage removed and both the flaps reposed.